feedback, and everyone can participate and fully understand the webinar as we go along. And also, if you want to ask any questions, please use the chat box, which is just over here. So you can ask questions in there, and you can provide reflections as you go along. If you are on Twitter or any social media, please use the hashtag CPA COVID, just so that you can share learning with others as well. And if you're on the Telegram group, please do feel free to discuss in there as well. So I'm going to hand over now to Victoria Rutter to get started.
Thanks, Diane, and thank you everyone for joining us. As Diane said, I'm the Executive Director of the CPA, and Diane's joining us here as our Global AMR Lead. So we're this year celebrating 50 years of working together to optimise medicines for health and wellbeing throughout the Commonwealth. And that's not just me and Diane, that's the whole of the Commonwealth Pharmacists Association, just in case you misread the heading down the bottom there. We're not that old yet. But it's really great to have so many of you join us. The response to this webinar registration has been overwhelming, and we've had over 500 people register from around the Commonwealth. And we're just blown away really at the kind of enthusiasm of our pharmacists, and how you guys are kind of really reacting to this pandemic. So let's move on. I just want to give you a bit of background about our mission and our vision quickly, in case you don't know who we are. CPA was formed in 1970, originally by the Royal Pharmaceutical Society of Great Britain, and we are now an independent charity. Our mission is to empower pharmacists to improve health and wellbeing throughout the Commonwealth, and we support safe and effective medicines management, healthier lifestyles, reductions in health inequalities. And we achieve this through building strong collaborative networks throughout the Commonwealth, and partnering with member organisations and policymakers to improve the quality of pharmacy practice. And another thing we do is create platforms for the dissemination of knowledge about pharmaceutical sciences and professional practice. So if we just skip on to some of our core activities. So I think many of you know us for our PharmAid scheme, where we distribute the recent back copies of the BNF from NHS hospitals and institutions around the UK to our member organisations. And that's a scheme that's been running for a long time now, since the 70s, and we're continuing to do that up to this year. Another thing we do is partner with member organisations to run conferences in their countries. At the moment, we've got a conference coming up in Rwanda later this year, although depending on what happens with COVID-19, obviously that might have to be postponed, but that's the conference that we are going to be holding at some point in the future. We do this because we want to try and raise the profile of pharmacy, and through our government connections, we can help to bring an international flavour to the conference, but also help to talk to policymakers around issues which are high priorities for the pharmacy profession in that country. We provide education, doing webinars is one of the ways that we do that, and we are also developing online continuing education resources at the moment, and we recently got a grant to do that, so watch this space. There'll be some things coming out very soon. We run campaigns, and we back the Antibiotic Guardian campaign and Fight the Fakes at the moment. That's two streams of work which we've been working very hard on. And advocacy is another important role that we have. We have very good links with the Commonwealth, so the heads of government and particularly the health ministers. So we are able to talk to them in that space about the issues that pharmacy profession has around the Commonwealth, and try to increase the priority of some of those. So should we move on to the next slide, Diane? That's all right. So I wanted to start really just by thanking you all for your tireless work as pharmacists around the Commonwealth and the response to this pandemic that we're facing. And here's just a few photos from our colleagues in various different locations. We've got some from Uganda and Malaysia, Pakistan, Singapore there, but there's many, many more that I could have picked. But the response has been phenomenal, and you guys are superstars in the work you're doing day to day, and it is not going unnoticed, and we are trying to make sure that we are drawing notice to the amazing work that you are doing to policymakers in the Commonwealth as well. So thank you for your hard work, and I hope this webinar is helpful. I'm going to hand over to Diane now, who's going to talk a little bit more about what we're going to cover in this webinar, and I'll come back to talk to you a bit later.
Thank you very much, Victoria. So during this webinar, we are going to provide brief information on COVID-19. We're going to aim to avoid reinventing the wheel because there is so much information out there. And actually, as I will tell you through our needs assessment we've done, there is a worry around information overload as well. So we just need to be careful that we're not providing extra information that is not being helpful. We are going to work through and share with you the needs assessment we carried out through the Commonwealth. So thank you very much. Many of you on the webinar provided responses to that, and this webinar is one of those responses that CPA is taking. We're going to very much focus this webinar around the resources that are available and how to access them. There'll be a session on question and answer and what next. This is where we look to you for you to provide us with feedback and how you want us to move forward. We found this spoof journal article which talks about interminable meetings found ineffective for the treatment of COVID. Again, alluding to the fact that there's so many meetings, and we need to be careful that those meetings and webinars are meeting the exact needs that are required. If you've got, as Vicky said earlier, if you've got any shared learning for us that we can share with others and promote and give opportunities for others to find out about, please email us at covid-19@commonwealthpharmacy.org. So just some key facts about COVID-19. COVID-19 is a disease that's caused by the newly named SARS-CoV-2. And it's part of the coronavirus family, so which is a large family of viruses that cause illnesses that ranging from common cold to more severe disease, such as the Middle East respiratory syndrome, so commonly called MERS-CoV, or the SARS-CoV, which is the severe acute respiratory syndrome. And so this particular COVID-19 particularly falls into the SARS-CoV element. And someone's writing on the screen at the moment, but that's okay. And also, it's a new strain we have, which has not previously been identified, and often it's called the novel coronavirus, which is where this fell into initially. They are viruses, as I mentioned earlier, and they're positive stranded RNA viruses. It was first detected in the city of Wuhan in China. And after multiple countries and spread across the world, WHO declared it a pandemic on the 11th of March, 2020. So just about 2 months ago. The mode of transmission is that it spreads directly from person to person through close contact, so usually less than 2 meters away. So that will explain why we have the advice of social distancing with about 2 meters. It is primarily through respiratory droplets, which are produced when an infected person coughs or sneezes, very similar to influenza and how influenza or other respiratory pathogens spread. When the droplets, if they land in the mouth, nose, or eyes of other people that are nearby, or possibly inhaled into the lungs, then this can cause the disease. However, there is a possibility that it can spread if people touch objects or surfaces which have been infected, from an infected person. So if an infected person or a droplet has landed on a surface which hasn't been cleaned appropriately, then this can also lead to the spread. What is unique about the coronavirus and COVID-19, though, is that whilst for most of the respiratory viruses, people are thought to be contagious when they're symptomatic, so when they're the sickest. However, with COVID-19, it's been evidence to suggest that asymptomatic people can also spread the virus, which causes majority of the concern. There are key ways in which this can be prevented, and actually many of there is nothing new really around how we prevent the virus from spreading from the evidence that is available so far. It's around cleaning hands, so appropriate cleaning of the hands through hand washing, or the use of alcohol or use of hand rub, ideally one that has been recommended with a formula recommended by WHO. The importance of coughing and sneezing into bent elbows rather than into hands, and obviously the reasons for that is that it's easier to touch items with the hands, and so increase the risk of spread. The importance of avoiding touching eyes, nose, and mouth, particularly when hands have not been cleaned. I guess with COVID-19 particularly, that this has become even more critical, is limiting social gatherings, and in many countries actually going into lockdown and social isolation and shielding for some categories of individuals. Avoiding close contact with someone that's sick, and the importance of cleaning and disinfecting frequently touched objects and surfaces. There was a lot of questions that people put into when you were registering. We asked what questions that you wanted us to answer, and so we're going to try and answer some of them through this webinar. There was several people asked for information about treatment. And with treatment, there is no specific medicine or vaccination or vaccine for COVID-19 at this moment in time. And also no medicines or vaccine has been fully tested for safety and efficacy. However, at present, there are multiple antiviral therapies that are being used, usually as part of clinical trials. In addition, so that's really key there, this is in addition to symptomatic and supportive treatment based on the clinical condition of the patient. So for some of the supportive treatments, these include oxygen therapy, hydration, fever and pain control, or antibiotics, only if there is evidence of bacterial co-infection. It is really important that we do not undo all the work we have been doing around tackling antimicrobial resistance and using appropriate use of antibiotics with all that hard work that we've done over time. Examples of antiviral drugs that are currently being used, and this differs between countries, include lopinavir, ritonavir, and ribavirin. So there's a range of antivirals being tested. I'm going to talk about chloroquine and hydroxychloroquine particularly. As we know, those are currently licensed for treating malaria and certain autoimmune diseases. These are also being trialed at the moment. However, clinical trial data is still very limited and inconclusive, and the beneficial effects of these medicines in COVID-19 have currently not been demonstrated. So just moving on to the needs assessment that we carried out. In March, on the 25th of March, we launched a survey across through inviting pharmacy professionals and pharmacy professional bodies across the Commonwealth to complete a short survey. This was really for us to understand what the needs were for our pharmacy colleagues across the Commonwealth, and also to see what issues were affecting our ability to respond to the pandemic as pharmacists and pharmacy technicians, and also how you as individuals and professional bodies were responding to the pandemic. And in addition to that, what support you believe would be helpful for CPA and other pharmacy bodies to take on at this time. It was a short survey for about 10 minutes, and we promoted it primarily through social media, so through Twitter, LinkedIn, Facebook, and also our Telegram groups. and also via CPA counsellors. So just to share the response rates very quickly, this is an interim results, and I'm very grateful to those who actively promoted within their countries to help us to get more than 500 responses overall from pharmacists and pharmacy technicians, and an additional 101 responses from pharmacy students. And this represented responses from more than 30 countries, majority of whom are part of the Commonwealth, but also some countries outside of the Commonwealth network, but very grateful that they wanted to participate in this as well. We had a range of participants from all sectors, so community and hospital particularly, but also academia and industry and professional bodies. And the gender, those who responded, it was almost 50-50 females and males. We asked particularly the impact of COVID on individuals, on personal life and on professional life. And what we found as time has gone on, because the survey was open for a month, in the first couple of weeks when we started, this was a different picture. We didn't have as many people being extremely worried or very worried. We had more of the somewhat worried and not so worried. But as time has gone on, particularly as the spread across the world increased, particularly into Africa and other continents, this has changed. And as you can see now, we have most people somewhat worried or very worried or extremely worried, both personally and professionally as well. So the impact on our profession as a pharmacy profession. We did also ask how difficult it was for people to work effectively, and we can see that this is somewhat difficult and very difficult. And this is the same across all parts of the world and all parts of the Commonwealth. We asked what support you wanted was required from CPA, and you can see through this webinar and some of the actions we've taken already that we very quickly responded to those and started to take action straight away. So the first couple of weeks, we noticed that access to community of support was actually much higher than webinars. And so we created the Telegram group, which we'll talk about in the next few slides, as a community of support. And then over time, that has now increased to having almost similar levels to webinars on COVID. There were also some other requests around advocacy, how to communicate, so supporting you on how to communicate key messages, and also training for preparedness, so particularly emergency preparedness. So now we're going to move over to the part of the webinar which talks about CPA's response to your needs, but also the resources that are available for you to access. As we talk through this, what we're trying to show and highlight is that there is a wealth of information out there already. What we've tried to do on the CPA resource page is to make this into a digestible format, but focused on the pharmacy profession. So there's so much information out there, but what we've done is picked out the key bits that we think as a pharmacy profession are particularly important for us. So the access to community of support, webinars I've talked about, and signposting to COVID information we'll go through in the next few slides. So in terms of community of support, we created a Telegram group, which is an app very similar to WhatsApp, but it's particularly, the reason we went for Telegram was also because it was possible for those who joined later to be able to still access the resources that people have shared over time compared to WhatsApp. And if you wanted to join the Telegram group, please do email covid-19@commonwealthpharmacy.org and we'll get that sent to you. Also to highlight that the WHO has a health alert messaging system where if you put that number into WhatsApp, then you'll be able to get access to relevant and up-to-date information from WHO. The webinar series, this is what we're going through now. So this is the first of the series, but the next few that we run, we will very much be responding to your needs and what you want us to have webinars on or to focus on. And we'll either do that as part of the CPA team, or we will invite other colleagues to join us with that. And some of them maybe will also be you on the call. So if you have any specific specialty area or particular information that you believe can be shared across the Commonwealth, please do put that into the chat box. And my colleagues, Nikki and Sarah, who are both on the call, will be able to collate that for us as well. So on the website, we have developed, we've pulled together the CPA resources into a toolkit, and I'll talk about an app as well that we've updated. So particularly for COVID-19, one of the things we've done very recently is to develop a COVID-19 toolkit. And this is very much using resources that have been developed through the Commonwealth Partnerships for Antimicrobial Stewardship, which is a program of work where UK colleagues have been working in Uganda, Tanzania, Zambia, and Ghana to tackle antimicrobial resistance through the use of stewardship. And through that period of time, the partnerships, there are 12 partnerships who are working in different institutions in these countries. They have continued to support, very quickly supporting colleagues in the countries to start to prepare for the pandemic. And some of the examples of what they've done is around providing hand washing facilities. This was done as part of the CWPAMS program, but has become very critical at this time for the COVID. So very grateful to those partnerships as well. Also developing hand sanitizers, so supporting the colleagues in Zambia particularly on local production of hand sanitizer. And this has actually become particularly exciting for us in a way because it has shown us the bidirectional learning of this partnership, because this was done as CWPAMS in Zambia, but when COVID-19 started, the learning that the colleagues from the UK learned from colleagues in Zambia was very quickly used in the UK, and there was local production of the alcohol hand gel and hand rub in the UK to support colleagues across Brighton. We have, as part of the CWPAMS project, we developed a program. We developed an app which was in partnerships with Uganda, Tanzania, Zambia, and Ghana, and you focused on having antimicrobial prescribing guidelines on an app system. And as you can see there on the left, it includes the WHO essential medicines list, but also the national guidelines from the 4 countries. The app, when we developed it, was very much focused on this project, and it's a proof of concept that we believe can be scaled up. And an example of scaling it up is the fact that in the last week, we have now been able to add COVID-19 resources to the app. And the COVID-19 resources that we've added is applicable to countries across the Commonwealth. For you to download the app, you would need to just search for MicroGuide in the App Store. And then click on Get Guide. And for the organization, you need to find Commonwealth Pharmacists Association as the organization, and then you'll see the CWPAMS app there on the left. So this is what the app looks like. So you get to the main app, and you can see there's a key focus around antimicrobial prescribing guidelines, and then infection prevention and control. And over the last week, we've included COVID-19. And within the COVID-19 section, we have included WHO guidelines, FIP guidelines, Africa CDC guidelines, but also the national guidelines for COVID from Ghana, Tanzania, Uganda, and Zambia. These are very much signposting. We are very much using the guidelines that have been developed by these organizations. And we've tried to do it in a way that when the organizations and the countries update their guidelines, that is also quickly reflected. But it provides an easy way to access these guidelines in one place. There's also signposting in terms of information for pharmacy teams, particularly, we have a particular focus around hand washing again, and you can see on the toolkit that we have the Bear Below the Elbow initiative, which was developed by the the Zambia partnership, so Brighton and Zambia, Lusaka partnership, and that has become really key now, and in terms of just increasing training across both sides of both countries. We've also been providing information on treatments. Again, this is all on the CPA COVID resources page. Information for pharmacy teams around the treatments available and relevant peer review publications that we believe will be useful. We've also included WHO COVID-19 Mythbusters, which is important and could be a really good resource for us to have or to access as pharmacy teams as we try to, particularly as members of the community, start to there's a lot of myths around COVID ongoing, and there's work that we can do around busting some of those myths.
I'm cool.
Vicky, if you can please help with me, thank you. There's also we've also signposted to the WHO guidance for the public. So this is again, how can you help in educating and communicating with the public, members of the public, so that they have appropriate information and up-to-date and current information as well. There's several international guidance and resources that are available through WHO. So again, that's easy to access, as well as the International Pharmaceutical Federation, FIP. I'm just going to pause there for a minute. Vicky, is there anything else you wanted to add so far?
Thanks, Diane. I think that's a lot of information, and we've got more to come. There's a lot of good questions coming through here. I just wanted to highlight a couple. One was about downloading the app. We've got some information about that on our website, and we can send out a link afterwards. So that might be the best way to address that one, so everyone's got that information. We'll also make these slides available in this recording, so you can go back to it. Lots of questions coming through, so thank you. Just keep them coming, and we'll try and address some of them at the end, if not in the chat box. Nikki's doing a great job there, so thank you.
Okay, thank you, Vicky. So again, we you know, this is a webinar we're running, but there are several webinars and events that have already been run, which provide amazing information and up-to-date information. And as we said, we are not trying to reinvent the wheel. We would really recommend that if there are particular topics that people want to hear about, we can make that possible of doing the research to find the particular topic areas, and then signpost into those particular webinars. But Africa CDC have been running a weekly webinars. WHO also runs daily webinars and daily updates. FIP has a wealth of resources, again, very specific, very focused on the pharmacy profession. I highly recommend that individuals access that, and they have gone right from the very basics of what coronavirus is, COVID-19, how to manage it, and also then access and talking to colleagues across the world, because they have a broader remit to see how they are reacting to the coronavirus pandemic. There are also training modules available, some through WHO, and I will highlight the Health Education England platform, which again is available and has a wide range of resources, both applicable for the UK, but also globally as well. And there's some resources, 100 questions by the London School of Hygiene and Tropical Medicine. It is worth accessing as well. And we have seen the resources, the member organizations, so these are CPA member organizations, have developed over time in a response to the coronavirus, and we have been collating them again in an easy to access way, so that we are sharing learning as we learn about them. So far we have found from these organizations, which are highlighted on the left, including the Royal Pharmaceutical Society, Canadian Pharmaceutical Association, Australia, New Zealand, Malaysia, India, Uganda, Ghana, Rwanda, Northern Ireland, and South Africa. if your organization have also developed specific resources for your members as a result of COVID, and you're happy for us to signpost to them so we can share learning wider across the Commonwealth, please again do email us on our COVID email website address. And in some cases, we are endorsing resources as well, if particularly where we consider that they will be, there's new information and will be applicable and particularly useful across the Commonwealth. For example, the Pharmaceutical Association and 10-step guidance for pharmacy teams. And also the hand washing video, which was developed by Ghana, is particularly helpful and a good one to share with members of the public, particularly on how to wash hands appropriately. And we're currently working through, actually, I'm going ahead of myself, I'll wait. And we're also signposting, as I said earlier, to key publications that we believe will be useful. And in some cases, and in some of the cases, there are publications that CPA colleagues, including our trustee, Zahir Baha, for example, our trustee, Zahir Baba, have contributed to or co-authored. So going back to the CWPAMS program and just trying to highlight some of the preparedness that has happened through the CWPAMS program. So as I mentioned, it's a partnership working to tackle AMR by sharing experience and expertise between UK healthcare professionals, many of them pharmacists, and those in Ghana, Tanzania, Uganda, and Zambia. And this example here, which is where the Brighton and Lusaka partnership developed and used the WHO formulation to actually produce hand rub. Again, as focused initially for tackling AMR, but obviously, as I've said now, has become so critical for COVID-19. And I don't know if many of you know, we had periods of time in the UK where it was difficult to get hold of hand rub. And so what we've now learned of recently is that the Brighton team also used that learning and in Brighton produced their own hand sanitizer using the learning from whilst they were in Zambia. As a result of that partnership, we are now working to develop an animation training on how to locally produce the WHO recommended hand rub formulation. And that will include interviews from colleagues in Zambia where they share their experience, the challenges they faced, and their key recommendations for action, particularly around auditing and just how you work through the different challenges that may come through. I'm going to hand over back to Vicky now to talk to you about what CPA is doing around advocacy, and then we'll go through to the question and answer session. Over to you, Vicky.
Thanks, Diane. So one of the other things that you asked us for around COVID-19 was advocacy, and that probably falls into various different categories. Some of the stuff that we're doing at the moment, I wanted to share with you so you realise how we're reaching policymakers on your behalf. So yesterday we had a virtual meeting of the Commonwealth Civil Society Policy Forum, and this event is usually run on the eve of the Health Ministers meeting in Geneva, but obviously was virtual this time. And we were present on a panel discussion, and we also submitted some of our work for presentation around the app we have developed that Diane has just mentioned that has the COVID-19 guidance on. So we were able to really raise the profile of pharmacy and some of the things that we're doing in the battle against COVID-19. And we also we will be putting recommendations from this towards the health ministers who are meeting later this month. One of the discussion points that came up was around making sure that we are using pharmacists to the best of their abilities and making sure that we are harnessing their full skill set in things like testing and vaccination programs in particular. So I will keep you up to date with how that goes in terms of recommendations. Any of you that want to listen to this 2-hour meeting, there's a recording link here that you can access, and we'll be again sending these slides around afterwards so you can take note of what that link is as well. So do you want to move on, Diane, to the next one? So the other thing that we've done recently is we had a meeting of all the civil society organisations, which there are several hundred of those affiliated to the Commonwealth. And we are one of the ones that represent health, obviously. So I'm just going to mute someone else. I can hear things in the background. So we are one of the many civil society organisations, and as I said, we represent health along with the Commonwealth Health Professions Alliance. And we had a meeting with Patricia Scotland, who is the Secretary General of the Commonwealth, and pharmacy was number 2 on the agenda. So I think that's a real positive thing for us. And we had a chance to talk about some of our work, and from that we've managed to secure some funding to support some of this work that we're doing, in particular looking at developing support for producing hand sanitizers in some of the African nations in particular. So there'll be more information about that to come. Obviously, because of COVID-19, a lot of meetings have been postponed, and one of those is the Heads of Government meeting, which is due to take place in Kigali in June. So there are still some virtual meetings going on, and we are inputting into those. And we've just had a commentary accepted, which is entitled "Here Together We Unite: The Role of Commonwealth in Achieving Universal Health Coverage Through Pharmaceutical Care Amidst COVID-19 Pandemic." And really, we want to get this into the hands of policymakers to raise the profile of pharmacy and demonstrate some of the things that we are doing and can do in order to respond to this pandemic. So that's a little about the advocacy work that we're doing. I think there's one more slide on this, Diane, if you just...
And apologies for the scribbles on the screen. They are individuals who are, I think, annotating the screen. So
yeah, not me.
For that. We can't seem to get rid of it. But if we can please avoid annotating, that would be helpful.
Yeah, the final piece of advocacy I wanted to talk about here is Sarah, who's also on the line here. She's one of our advisors, and she's been our international partnerships lead for the Commonwealth Partnerships in Antimicrobial Stewardship. We've had a letter published here, as you can see, in I think it. Let me just mute. Kids at home like me. So we've had an article published here with the BMJ, a letter in response to healthcare workers obtaining information, and really this was around highlighting the use of our app and how our app can be used at point of care prescribing. There's no need for internet access, and people can have that information at their fingertips. So another kind of strand to this really is the fact that, you know, we still need to talk about antimicrobial stewardship, and things like that tend to go by the wayside a bit in pandemics, but it's more important than ever. So that's something that's been highlighted by various different meetings that I've been to. So if we just skip on to the next slide, Diane. So that's the advocacy element of what we've been doing, and there's more meetings to come. But some of you have been asking about the Commonwealth data in the question box here, and just wanted to point you to this website. There's a link to the in the top right hand corner here, and each day at 5 o'clock this data is updated. So you can see that we've got the number of confirmed cases, deaths, how many people have recovered, and this is by the Commonwealth, by regions, this is Africa, and then by country. So there's just Botswana there as an example. There's a lot of information here. And have a look if anyone's writing any papers or doing any kind of research. It's a really useful resource. So I just wanted to highlight that to you as part of the signposting efforts that we're doing today. So do you want to move on, Diane.
Vicky, I'm going to suggest that we pause for a minute and take some questions whilst you see if you can remove the scribbles on the screen and the annotations. I suspect if you click annotate, maybe you might have an eraser on your admin system.
I'll have a look. Do you want to
okay.
start?
So we're on to the next steps now, and which is really for you to please share with us how we can best use this webinar series to support you in the most effective way. One of the questions we got asked through the registration was certificate for attendance, and what we will do after this webinar is we will send you a link just to give feedback on the webinar and what else you want to see again, and then we'll try and automate the certificate process. Otherwise, we'll send an email out to those who wish to receive a certificate. So this time now is an opportunity for us to hear from those on the call. Please all stay muted. And I guess I will start with the counsellors on the group. So if there's any CPA counsellors on the group, if they wanted to share anything in particular, please let us know and we will unmute you.
Raymond's got his hand up.
Raymond, okay, right, there you go, Nikki. Vicky, you can unmute him.
Unmute you. Hi, Raymond.
Hey, thanks very much for a great presentation, and I think it is really good to see something which is concise, gives us the real information which we need and which can be shared. I think it's brilliant that we can actually share this, and if we get the link, we can share it with our other colleagues, who haven't been able to attend today. The one thing I just really want to say is that certainly in my work and in the area that I am in, the role of pharmacy and the pharmacists have really risen to the challenge. We have been highly acclaimed for being available, being still the first point of call for people to speak to. We found a lot of general practitioners and physicians closing their doors to people coming and having difficulty seeing a doctor. And I don't want to lose, I don't think we should lose the momentum of what we have actually achieved. And it's important that we actually make policymakers aware, through this whole pandemic, pharmacy has been there at the front line. And it's important that we just continue not to lose that in any discussions which we have.
Absolutely. Thanks, Raymond. For those of you that don't know Raymond, he's our immediate past president from Northern Ireland, and he works as a community pharmacist. So he's been very busy in the last kind of few months and been really at the front line here. There's another question coming in from Marianne, who's our regional representative in Malta. So I'm going to ask Marianne if she wants to say anything.
Hello, hi, hello. First of all, it's very interesting that you're doing these webinars. They're very useful. In Malta, well, we've risen to this challenge as well. And as Raymond said, we're in the forefront. We're frontliners. As regards community pharmacists, we have taken various roles, like we discussed with all stakeholders, and now we are repeat prescribing for chronic treatments. We have been striving to do the repeat prescribing for chronic treatments for ages, and now through COVID, we managed to achieve it. As Raymond said as well, pharmacy has taken on various roles, as the doctors in health centers were taken elsewhere to hospital. So more or less we were the healthcare resource in the community. And I hope that through lobbying and also through advocacy, we managed to retain these roles. Something else that we've achieved was that we organized a delivery system for medication through the National Health Scheme for patients who are elderly and also the vulnerable, those with say insulin-dependent diabetics, immunosuppressed patients. This was done through a partnership with LESA, which is the traffic control system. They provided us with the drivers and also the pharmacy students. Apart from that, the pharmacy students took an important role as well in this COVID pandemic because they were able to prepare the sanitizing solutions, the sanitizers. So it's good. It was a good thing for them, a learning experience, but they were also hands-on. We provided the equipment for them and also the protection. Now, as regards how we worked in partnership with the authorities, with other healthcare organizations, with the medical association, with psychiatrists, with head of department, in order to move forward, to address the problems and concerns that we're facing, and also the problems. And so far we managed. Something else that I would like to say is that sometimes, we know how politicians are. They take over, they do something without liaising, without dialogue. And we've managed, to hold discussions. They were very difficult discussions, so as to find a way forward and not to weaken the pharmacy profession.
Thank you so much, Marianne.
And also something else is that on a weekly basis, we have webinars. These are being organized by the CEO of the Medicines Authority, who was the past head of Department of Pharmacy, Professor Saracino Glot. He invites people from different areas, virologists, people of special interest, and very enlightening, and it provides us up-to-date information of what's going on. The latest one was on the vaccines, which was extremely interesting. Thank you.
Thank you so much, Mary. I think we'll go to Nancy now.
Nancy.
Can you unmute me? Yes, thank you. Oh, it's so good to see everybody on Zoom. Essentially, I would like to say very much that Malaysians very happy that we have an opportunity to serve, and pharmacists in Malaysia have a fairly strong reputation and image among the community. What we've done is that we win goodwill through raising funds with other professional bodies to distribute PPEs and face masks and things to the government, to the people, and that has really put us on a very high profile situation. At the same time, we also have gone on the website as well as Zoom to discuss matters regarding COVID and its impact socially, economically to our community here. So I believe that some pharmacists have done a lot in terms of the frontline position that we occupy. And at the moment, the country has got rapid test, and we also want to have a piece of action in that kind of testing for COVID-19. So definitely we have not closed shop. All our community pharmacies have stayed open right through the lockdown. And I believe that we will continue to enjoy that kind of goodwill and support from our community for the good work we have done. So we're very, very thankful for that.
Thank you, Nancy. That's great to hear.
Can I just reflect on that? And I think that that's really important in terms of the goodwill that will continue as a result of us going beyond and above our usual roles. So thank you for sharing that example as well.
Yeah,
thank you.
Just to point out, Nancy's our Vice President from Malaysia, and we've also got our President who wants to speak next. So I'm going to hand over to Rao Bhagamudi from India. So I'm just going to unmute you, Rao.
Yeah, hi.
Hi, Rao.
Hi, this is Rao, and then this wonderful activity, Vicky and Diane. I'm very happy that there's the points mentioned by Raymond, Marion, and Nancy. I just would like to add here, in a country like India with a huge density of population, we we are facing a different situation altogether. Pharmacists on the front line, they are working under these challenging times in the community and in the hospital. Nevertheless, there are also other pharmacists who are working, the pharmaceutical scientists in the industry, the pharmacy students from the various pharmacy colleges, and particularly the pharmacists who are drug regulators in various states. I know many of my pharmacist friends who are working as drug regulators are almost 24/7 working, ensuring there is supply of medicines, because there is a lockdown for the past 40 days. And the production of essential medicines, particularly the hydroxychloroquine and chloroquine and related medicines, industry is working on that to supply not only for the domestic requirement of India, but also for the global requirements, because Indian pharma industry is regarded as the pharmacy of the world. In India, we also face a very peculiar situation. Probably other countries, I do not know whether they face, because during the harvest season, during the summer, there's a lot of migrant population moving from one area to the other area for jobs and, in the construction sites, jobs in farms, fields, agriculture. They're all stuck at different places, and feeding them and ensuring that their safety and that they are not exposed to the COVID situation is a tremendous job. So the healthcare providers, the police, and various other philanthropic groups, etc., are supporting them. And at this particular point, I want to really thank pharmacies, college managements, and students, because at many places they have played a major role in providing food and other daily requirements to all these people who are stuck. So I think pharmacists on various fronts, various wakes of life, are standing up and performing, a wonderful service in these testing times all over the world. So we even wrote letters to the Prime Minister and Health Ministry that pharmacists and pharmacy profession must be recognized as one of the top leading healthcare professional groups in India. Of course, this is some advocacy that we need to do with our government, because pharmacists many times are unsung heroes. So we are ensuring that the pharmacist services are recognized and they get their due recognition from the government and through politics, whatever. Thank you. It's a wonderful activity, Vicky and Diane. I thank you once again for giving me the opportunity. Thank you.
Thank you, Ra. I think what you said there around the other, our colleagues in other aspects of pharmacy who are not traditionally classified as frontline is really important. I think I've come up with the term backline because I guess in many ways in my other role in Public Health Institutes, that's where I mainly from, but actually we're having to write policies, guidelines and guidance to support those in the front line. So it's really important that, and colleagues in industry as well, and those who are managing the supply chain as well. So really important that they are also recognized in this because actually all together we are taking action. I do highly grateful also that you mentioned the pharmacy students and their role that they're playing in that, because many of them are having to take on other roles that they didn't plan as part of their pharmacy degree. And I know certainly in the UK, we have examples of students who have gone out to do deliveries for those who are in the shielded category or isolated because they can't go home. So thank you for reminding us about that. Nick, Vicky, who else was going to talk? I think we've got Mariam Hines. Mariam,
where are you from?
So if you unmute yourself, please, Mariam, or Vicky, you're
yes,
muted.
Good morning. I'm from Barbados, and it's just almost 9 o'clock in the morning in Barbados. Wow. And I just want to say thank you so much for the for this organizing this webinar, and I am definitely going to share it with my staff. And I just wanted to report that in Barbados, we pharmacists have been in the forefront. We had an emergency operations center set up to be advising the government on policies to take with regards to, with other public health personnel, of course. But just to say that I myself, I'm the director of the Barbados Drug Service, and I was on the Emergency Operations Center. And we had also set up a national security for overseeing the COVID-19. And it was an honor to have a pharmacist on board, and also to say that pharmacists have been playing their role in Barbados in different forts. Even when the whole place was closed, gas stations and pharmacies were open, even when supermarkets were closed. But eventually we started to open the supermarkets by alphabetical names, and we're still doing that. And I must say that it is very good when we can uphold and enrich each other, because sometimes I feel as if pharmacists were being left out. I don't like the back end part. It makes me feel as if we're in the back. But nonetheless, I understand the meaning of it in seeing that doctors and nurses are usually the ones that are seen, because the ones directly attending to the patients and so on and so forth. But to say that I really appreciate this forum and the resources that it is bound to provide. Yesterday, I introduced my staff to it who were not aware, and I think because of the time difference, it would have been just a few hours notice. They probably would not have been able to join, but it is something that I'm going to make sure that the May session, I'm not sure what the topic is going to be, that they will be able to be part of it, that we can be learning from it. And I'm happy to say that right now we have a company that wishes to provide us with some formulation, hypochlorous, that they think that will be able to have nebulizers that can actually be used to nebulize to kill any antimicrobial fungus, virus, bacteria, and so on, and also to be able to kill them on hard surfaces and whatever that they think can be used to sanitize aeroplanes and ships so that the cruise liners can continue. And pharmacy, I've been mandated to actually put together a group of scientists to work on this, both from the clinical side of it, with the aerosol that will be used to for aerolizing patients, and also to set up another committee of scientists, maybe microbiologists and whatnot, that would see the impact on hard surfaces, maybe making comparative comparisons with others. It's before the US FDA as well, but I think that if we have the resources, we might be able to even go before US FDA, because US FDA is a little bit more technical. In our limited resources, we are more able, although we would be more pleased if we can have more stringent regulatory authorities approve them even before us, so that at least we can be able to agree with them either by convergence or whatever. But just to say that, yes, we pharmacists in Barbados and in the Caribbean, we are indeed trying to do our best as well. Thank you very much for allowing me to speak.
Thank you. That's really great to hear. Thank you. And just to say that pharmacists are definitely in the front line. I think what I was trying to say is that there are, in all professional groups, there are those who are working directly patient facing, and there are those who are working in terms of policy development as well, to try and all together we're critical to this pandemic response. Okay, Vicky, who's next? I think we can take one more and then we can round up.
Ash is on the line. Ash, do you want to say something if I unmute you? Ash, can we hear you?
He's still on mute, Vicky.
I think we're both trying to unmute him at the same time. Ash, I think we can hear you now.
Okay, can you hear me? Good. Thank you. Thank you, Vicky and Diane, for what's been really, really useful in terms of what you've got. The thing that strikes me is that given where we are today and what's likely to happen over the course of the next couple of weeks even, is that we're going to start to see some countries emerging from lockdown and some transition to whatever we call the new normal. But one of the things that's going to become quite apparent because of the pace of change that's going on is the expectation that we'll probably be in a position that we'll be able to start looking at testing. And I know that in the US, they've started to test already. And I understand that Roche are very close to having a test available, which is they reckon is 99.8% effective, which would meet the criteria we need. So possibly one of the things that potentially we should look at is what are the options for pharmacists to be involved as this progresses in testing and in helping to identify how we move on from what is still going to be some form of social distancing towards normality again.
Thank you, Ash.
Sorry, Diane.
Thank you, Ash. I think certainly something that can be considered and can go through and see what pharmacists all across the Commonwealth are going to do and how they will respond to that. I don't know if Vicky wanted to add anything to that.
Yeah, I think it's a really important point that we're all going to be coming off lockdown at different times, and I think different countries are obviously at different points in the curve at the moment. So I think it's definitely something that we probably need to address, like looking forward, maybe what's the role of pharmacy as well as like in this current time now. I think I just wanted to draw our kind of conversation back a bit to what we're going to do for the next.
Sorry, Vicky, I apologize. I think there's still two more people who have had their hands up for a while. So Wazim and Deba.
Okay, fine.
Deba Smita. So if we take those two, and then we'll stop. So apologies, we're going slightly over, but I think it's, as they've had their hands up for a while, it'll be helpful if we can hear from them.
Sure, let's do that. I'm just going to unmute. Can we go to Deba Smita first? Hi, can you tell us where you're calling from?
Hello.
Hi.
Am I audible?
We can hear you. Yeah.
Yeah. I am from India, and I am a B Pharmacy student. I am in my final year. So I feel this program is very much interesting. And one thing I must add, like the professional or the student who are in this field, they are attending this kind of program. But what about the common man, like the more information is needed to the common man so that they can access all the facility in their curriculum, so in their practice also. So I want to add, like, this kind of awareness program are limited to the public or the student who are in this field, but somehow the common man, the awareness is still needed, particularly in my country.
Thank you. So I think what you're saying is that these sorts of webinars are very much needed as part of the curriculum for pharmacy students. Is that right?
Yes.
Okay. No problem. Okay. No problem. Do tell us examples of how you think we can help support this. If you put that in the chat box, we can work through to see what we can do about that. Thank you. It's great to hear from a pharmacy student. And I think Wazim is next, Vicky.
Yeah, Wazim, over to you. Can you tell us where you're from, please? Trying to unmute you. Not working. Can't seem to unmute Wazim.
Okay, so in that case, Wazim, apologies. We've tried to unmute you, but we can't seem to do it. Please put in the chat box. Vicky, are you happy to close, to go back to this? I will.
Got network problems, he says.
Okay, that's fine. Okay, so Vicky, sorry, we've got Vicky in our team as well, so we're not going to.
Thanks, everybody. Some really interesting questions and points there, and it's really, really good to be able to share what's been going on in different countries. I think we wanted to just draw your attention back to this question of how can we use this webinar series to support you in the most effective way. So, having now kind of had a chance to kind of talk to you about the resources out there, and we've had a lot of questions come through on the chat box. Some of them we've answered, some of them we've parked because we know that we need to kind of go away, probably do a bit more research and come back to you. How can we best address your needs in these webinars? Is it helpful to have sharing events so we can talk about what's happening in each country? Is it a good idea that we pick particular topics and we can find experts on particular areas to come and talk about things which you're most interested in? So if anyone's got any points around that, I'm going to ask you to kind of raise your hands. I'm going to lower people's hands that have got them up already. So if you want to just raise any questions about that specifically, perhaps you could put your hand up now, or otherwise just type it in the chat box and we can pick it up from there. But really, this is your webinar series. What can we do? We don't want to reinvent the wheel. There's lots of great stuff already going on out there. So what can we do that's useful for you? We've got some questions coming through on the chat box. Anything else that anyone wants to ask? Nothing from our participants. I know we're going a bit over time, so maybe people have to go. Drug use in COVID-19 is something that people seem to want more information on, and I think that will be quite useful, especially moving forward when more evidence is coming out. I think Ash raised the point about testing. Perhaps that's something that we can kind of visit. And again, all this stuff is very new and evolving, so it's very good to be able to discuss things across international boundaries and learn from each other. So I can see Eric's raised his hand. Eric, can you just tell us where you're from and what your question is?
Hi, thank you Commonwealth for organizing this kind of a meeting. I appreciate it, and that was good. I'm calling in US now. My concern is what are the new information that can be put now post-COVID? Because so many people are going to be testing positive, antigen at the same time, antibodies. And mixed information will be out there for both families to be supported at the same time, the individuals. And if they were asymptomatic, what are the information that have you started gathering as a community of pharmacists?
I think that's a really good point. Diane, have you got anything to kind of add on that? I think as healthcare professionals on the front line, we need to be in a position to be able to advise the public on things like this as well. And I think the data is still coming out. We're not, we haven't done all the research yet, but it is emerging. Diane, have you got anything else to add on that?
No, nothing. I think the approach taken by different countries is adaptable for that setting. But I think also WHO has provided key information already. So I think we can help seek the information and see if there's and possibly asking FIP as well in terms of what is specific for pharmacy professionals.
Yeah, I think so. Thanks, Eric. Any more questions from the floor here? There seems to be a few things going on the chat box here about using nebulizer solutions, disinfectants. There seems to be quite a few kind of treatment things that we might need to look into and perhaps run a webinar around what the treatment options are here. Anything else from anyone? No. Okay, so Diane, have you got any closing thoughts?
Apologies, trying to unmute myself.
Okay, we've got one more question coming in. Should we just take that one and then?
Yep, no problem.
So this is, oh no, she's changed her mind. Well, he's changed her mind. It's okay. So I think if unless anyone's got any more questions, we will wrap up, and I think we'll just try to put together a kind of list of possible next topics for our webinars, and perhaps we can circulate this to the group and see what your thoughts are on those. Does that sound like a good plan?
Yes, and also we'll send you a link to some of to be able to if you're interested to access the certificate of attendance based on the multiple requests we got from the registration that people would like to have a certificate of attending the webinar. And as Vicky said, I think somebody put a question about what's the webinar topic for the 14th of May, which made us all smile. We hadn't planned of having weekly webinars. We're not sure that that's necessarily needed because FIP, for example, is running regular webinars as well. So we will look at what you want us to do that's specific around the Commonwealth and specific for the pharmacy profession, and we will definitely put out the next date. We've been it's been great to see over 500 people sign up. We only publicized that, we only put out the link for the registration on Monday, I believe. We've had over 500 people sign up already. So we are pleased to know that this is hopefully meeting a need. But please do tell us what's been most helpful, so that we are responding to needs directly rather than what we, members of the team, think is needed. But thank you for taking the time to join us today, and thank you for attending the webinar. Thank you for sharing the webinar. We have recorded the webinar. We will make the link available again through the email we'll send to you after this meeting.
Thanks, Diane.
So Vicky, please don't end the meeting. Don't end the meeting, rather. Thank you, everyone. We've closed, the webinar is now officially closed.
Thanks, everybody. Stay safe.
Thank you very much.
Thank you.
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 Thank you, everybody.
Thank you.
And thanks a lot.
Thank you, everyone. Thank you, everyone.
Thank you, people, for sharing this useful
Thank
information
you.
with us.
Thank you.
Thank you.
Thank you. Thank you. Thank you, everyone. Hi.
Thank you very much.
Thank you.
Thank you, too. Thank you.
Thank you.
See you all next time. See you all.
Goodbye.